direct instruction lesson on PHI, which is also known as Protected Health Information by Toy Snipes. Health protected health information, also known as PHI, falls under an umbrella of health privacy. There's a lot of different facets that are involved health privacy, but for the specific lesson, we're going to focus on PHI to break it down. And I just want to give some definitions. Uh, the first definition is HIPAA, which is the Health Insurance Portability and Accountability Act of 1996. It is a federal statute enacted to protect personal health information. A statute is a law that a legislative body passes. A covered entity may belong to one or more of three categories, which is healthcare provider, health plan, and healthcare clearinghouse. Just to give a little bit more context, a healthcare provider is organization or a person rather that transmits any health information pertaining to certain transactions, so financial or administrative in electronic form. A healthcare provider can range from an individual practitioner to a large healthcare organization. A health plan, which is an individual or group plan that an individual or group plan that provides or pays the cost of medical care. And a healthcare clearinghouse is an entity that processes billing transactions between a healthcare provider and the health plan. Also, within our definitions, we have a workforce, which is a covered entity's paid employees. And then also we have a business associate, which is a person or organization not a part of a covered entity's workforce that performs functions or activities on behalf of the covered entity that involves the use or disclosure of PHI. So HIPAA's privacy rule safeguards protected health information across all mediums such as paper, electronic, and imaged. To be PHI, information collected from an individual must meet three parts. So there are three requirements, and the first requirement would be the information should must either identify the person or provide a reasonable basis to believe the person could be identified from the information given, including demographic information. The second requirement is that the information must relate to the individual's past, present, or future physical or mental health condition, provision of healthcare, or payment for the provision of healthcare. So basically, the information must relate to health information. And then the third requirement would be that the information is held or transmitted by a covered entity or a BA in the form of a or in any form or medium, including electronic, paper, or oral forms. So we've already defined protected health information. However, I just want to go a little bit into identifying information a little further. So, in terms of HIPAA, there are actually 18 identifiers in terms of health information, and I can go over those now. Uh, the first identifier is names, so a consumer's or patient's name. The second identifier is geographic subdivisions smaller than a state, including street address, city, county, precinct, and zip code. And then the third identifier would be all elements of dates except the year. So that directly identify the individual, including birth, admission, discharge, and death dates. The fourth identifier would be telephone numbers. The fifth identifier would be fax numbers. The sixth identifier would be email addresses. The seventh identifier would be social security numbers. The eighth identifier would be medical record numbers. The ninth identifier would be health plan beneficiary numbers. The 10th identifier will be account numbers. The 11th identifier will be certificate or and license numbers. The 12th identifier will be vehicle identifiers and serial numbers, including license plate numbers. The 13th identifier would be device identifiers and serial numbers. The 14th identifier would be Web Universal Resource Locators or URLs. The 15th identifier will be Internet Protocol or IP address numbers. The 16th identifier will be biometric identifiers, including fingerprint and voice prints. The 17th identifier would be full face photographic images and any comparable images. And the 18th identifier will be any other unique identifying number, characteristic, or code except for permissible re identification. And so those are the 18 identifiers that I wanted to list or let you know that are characterized as identifying information in health information. Now, de-identified information is a way to protect health information, and so therefore, if you do have a de-identified information, it basically has the personal characteristics removed from it, and basically, it does not identify the individual, nor is there a reasonable basis to believe that it could identify an individual. There's basically two options in reference to HIPAA for de identified information. The first is the safe harbor method, which basically removes the 18 defined elements that we previously mentioned to ensure that the patient's information is de identified. And then the other method would be to use an expert to apply generally accepted statistical and scientific principles and methods to determine the risk that the information might be used to identify an individual is minimal. So these are the two ways to make sure that information is properly de identified and in reference to HIPAA. Another way to protect PHI would be to use the minimum necessary rule or requirement, I guess, in terms of protected health information. So, uh, this could an example of this could be if you were at a hospital and you wanted to fill out a request form to have your information sent to another individual, then the it would be on the responsibility of the healthcare entity that you're working with to use the minimum necessary requirement in order to protect your information. And that is essentially what it means is that the covered entity or BA, which is the business associate, including their workforces, must limit PHI uses, disclosures, and requests to only the amount needed to accomplish the intended purpose. So basically, in other words, it means that people should only access information if they have a business need to know. So, like it's if you request that only your medication list be sent to another individual. It should literally be your medication list. It shouldn't be your entire record. And so, this minimum necessary requirement is used as another way to protect the health information. So, I wanted to highlight the critical information of this lesson. Critical information is just the understanding that protected health information is essentially health information plus identifying information by a covered entity or BA, or that's held by a covered entity or BA. And then also, there are two ways that you can protect protected health information, which is to use the minimum necessary method or to de-identify the information. Those are the two methods that we discussed in this lesson. And then also HIPAA's privacy rules safeguards protected health information across all mediums, such as paper, electronic, and imaged. If you would like further information about the topic of protected health information or health privacy in general, feel free to check out the book that I reference for this particular presentation, which is Introduction to Health Information Privacy and Security, second edition by Lori A. Reinhardt Thompson. And this book is a really, really good resource to learn about health information and particularly protected health information.